There are some things you can always count on at Big Ten universities. Great vibe at sporting events, a first-class education, and pioneering medical research. The last one is significant for all of us, not just in the United States, but around the world. Our first story begins at the University of Wisconsin, where medical research has led to medical innovation.
I remember sitting in the hospital overnight, and I was probably as scared as I've ever been in my life.
Frank Fetter will never forget an April evening in 2011.
They at first thought I might be having a heart attack, and then thought there might be something wrong with my gastrointestinal tract. Both turned out to be okay, but my blood work came back not very good. I was very obese, obviously, and I had high cholesterol, high triglycerides. I had what was called fatty liver syndrome. My blood pressure was too high, and I had high blood sugar. It was clear that I was going down a very, very bad path.
He'd gotten to a place where he was withdrawing because he was not happy with himself and where he was. He was depressed. And, there were times when he would even break down, from that.
Frank's life would begin to change for the better after that night, thanks largely to the pioneering research and treatment at the University of Wisconsin-Madison.
The University of Wisconsin Hospital and Clinic's Preventive Cardiology program was the first academic preventive cardiology program established in the United States. We focus on preventing first and recurrent heart attacks and strokes.
Dr. James Stein and his team had made 2 medical advancements at UW to treat those patients at risk of a heart attack. The first is a vascular health screening program that allows doctors to literally see inside a patient's arteries through carotid ultrasound.
Sometimes we'll have a 45-year-old patient come in and we'll find that he or she has the arteries of a 75-year-old. We may have a 60-year-old patient whose doctor thinks they need to be on a cholesterol pill or a blood pressure pill, but isn't quite sure. By taking pictures of the artery in their neck, by determining their vascular age, we might be able to tell them, you know what, you're doing okay, you don't need medication, and you can just focus on improving your lifestyle with diet and exercise changes. We started in 2001. Only a handful of programs around the country did it, and we were only doing a couple hundred people a year. We now authored guidelines that are used nationally for vascular health screening, and there are over 100 sites in the United States doing carotid ultrasounds to assess people's risk.
The other breakthrough, called Active Living and Learning, or ALL, is a preventative cardiac and diabetes program.
Initially, our program dealt with patients who'd already had some kind of heart event, heart attack, surgery, those kinds of things. But we said we really need to be much broader than that. We need to get in the area of preventing heart disease before it happens.
At first glance, ALL appears to be just one more diet and exercise lifestyle program. But there's far more than meets the eye. ALL employs 3 strategies to ensure long-term health. A lineup of professional coaches, including nutritionists, exercise physiologists, and medical doctors.
We also have a health psychologist come into the program periodically and meet with people around what their barriers are and what motivates them and what keeps them from making the changes that they're making, and coach them through that process as well.
We also have a financial inducement to being in our ALL program. We have successfully negotiated with several insurance companies so that if a patient pays for the ALL program up front, let's say $1,500 to be in the program, but they successfully complete the program, at the end we will give them their money back and the insurance company will pay for the program. To me, that's a win-win situation all around.
ALL boasts a success rate of 95%.
The excellence of our ALL program at helping patients lose weight, helping patients start exercise, was recently recognized by the United States Centers for Disease Control, the CDC, who are now using our program as a demonstration project for the rest of the country. A demonstration project for how academic medical centers, insurance companies, and patients can partner in a cost-effective and efficient way to bring the best of research to patient care and help prevent heart disease and stroke.
Why don't you just post it on the refrigerator? Don't eat that cookie or whatever.
ALL was the perfect prescription for 50-year-old Frank Fetter.
Since the program started, my body fat has gone down by 7%. My waist measurement has gone down by 2.5 inches. My cardiovascular health has improved tremendously.
And it turns out that a 5 to 7% weight loss makes a really big difference to the kinds of things that are really important to their risk: blood sugar, cholesterol, blood pressure. So it doesn't take much.
Very good. 122 over 76. Much lower than 12 weeks ago. You were spot on.
It's really made a difference for him. His relationship with the kids has really gotten better. I think the biggest change is probably in his outlook. He's very proud of himself, as he should be.
I am optimistic about how I'm going to do after this program is over. That's not to say that I'm not a little bit worried, because this really has become a security blanket for me. I still think I'm a work in progress. This has given me the tools to go where I want to go. I'm not there yet, but I know that I can get there now.